guys, welcome back to the channel, and today's unit is 10, and this unit has lots of names. There in one book it's different, and in another book this chapter has different names. For example, assessment and management of high risk newborn in one book, and in another book if you see NICU admissions. So generally in this chapter you'll get to know after the birth what are the risk factors or what are the complications that is seen in the baby, and that is leading to NICU admissions. That is you're seeing in this chapter, and from this chapter you'll get one question for 5 marks, one question for 2 marks. So totally 7 marks. If you read this chapter you're perfect with 7 marks. NICU or Neonatal Intensive Care Unit. Soon after the birth, if the baby has any kind of complications or any kind of disease or any kind of illness and it requires special care, so NICU is set. This is a special unit where they will provide care for the baby's illness, and the main aim of this neonatal care unit is to reduce the disease and the death rate of the baby. And what are the frequent cases that gets admitted in the NICU are the low birth baby, that is premature baby, and if the baby has large weight, if the baby is very big, and if the baby has any breathing problem, or if the baby has any urinary tract infections, mainly jaundice is largely seen cases. These are the cases that get admitted in the NICU. Nursing care in NICU, we need to change the tubes regularly, and cleaning the area should be maintained. And from one baby to another baby there should be a separate articles. There should not be any common articles, and we should maintain our hand hygiene, and we need to wear gloves. Safety measures should be followed strictly, and minimize the use of catheter should be done. Sterile fluid administration should be done in a sterile way, and we should promote the eternal feeding, that is avoid the bottle feeding. And we need to keep on checking that is there any nosocomial infection that is affecting the baby or not. Nosocomial infection, that is hospitalized infection. And waste discharge should be done properly. There should not be any accumulation of waste, and mainly the blood or the waste that is present in the cottons, everything should be discarded. These are the nursing care of the NICUs. Next topic that we are going to deal is preterm labor, and preterm labor is already explained it in the unit 8 part C. If you want in detail you can go and visit there, but one thing, the complications I've been missed that one. So here, if the baby is born before the full term, what are the complications? First, it will affect the brain and heart. That's the main. The brain will not get fully developed, so there will be a disorders like no coordination, no proper growth, there is no proper postures, there will be a problem in walking, delay in walking. These are the problems that is seen regarding the brain. While vision, the eyes is also not properly developed, so there will be a vision problem, hearing problem will be seen. And apart from this, heart, in heart there are lots of defects. In very small age the baby might get asthma, breathing disorders, and heart disorder, holes in heart, or a heart destructure. This can be seen in this condition. These are the complications that is seen in premature babies. Physiological jaundice or neonatal jaundice. This is one of the common condition in which the baby gets admitted to NICU, and almost 50% of babies get this jaundice. Here the baby's skin almost turn yellow, and here the serum bilirubin level will be less than 5 mg by dl, and the cause is generally the external factor. Before birth the baby stays inside the womb, it will be very secure. While get exposed to the outer environment, the baby gets jaundice. So if the mother and baby has different blood groups, and the drug vitamin K can cause jaundice, and the sudden fall of temperature, sudden fall of glucose in the blood, infection, breathing problem, and suddenly there is a bilirubin level more in the blood. This causes physiological jaundice. Management is very simple. We will first assess how much level the bilirubin is present in the baby's body, and we will do physical assessment like what is the skin color, eye color, and where are the yellow discoloration is more. We will check like that, and then the treatment is very basic: breastfeeding, phototherapy, and sunlight. it's enough and the baby will get cured. If there is any other complications coming, we will recommend pediatrician. Care for baby under phototherapy. What is the nursing role in this condition? See, in less frequency of light, the baby will be placed naked. And one thing, the baby should not expose to the light for long period of time. But mainly in high frequency of light, the baby's eyes and genital part should be covered because it will damage the parts. And the baby should not be exposed to radiation that is too hot, should not be placed, and even the baby should not be kept too cold area. The baby should be placed alternatively in regular frequency of time. And because of placing the baby in the heat thermal temperature, the body fluids will evaporate, so extra fluid should be provided, and kangaroo mother care should be provided. Mother should touch the baby, mother should talk with the baby, so interaction will actually heal the baby faster. And next, regular feeding should be done, by which the jaundice can get cured fastly. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.